We presented HER2CLIMB-05 today. This was a registrational trial looking at the benefit of adding Tucatinib to HP maintenance in the first-line setting for HER2-positive metastatic breast cancer. The goal is to prolong progression-free survival and also prolong time off of chemotherapy. This trial enrolled patients that were both HR positive as well as HR negative. Over 600 patients were enrolled, and the primary endpoint of progression-free survival by local assessment was met with an 8.6-month improvement in progression-free survival. We did break this data down into the HR negative and HR positive subsets. Again, the HR positive subset of patients were allowed to receive endocrine therapy. We only had about 45% of those patients that did receive endocrine therapy. The benefit was 6.9 months, and this was statistically significant. In the subgroup of patients that had HR negative disease, this was also statistically significant with a magnitude of benefit of over 12 months. In terms of tolerability, there weren't any big surprises. We anticipate seeing LFT abnormalities as well as diarrhea with the addition of Tucatinib to regimen. We did see about 13% of patients discontinuing Tucatinib, and the majority of those patients discontinued did so due to AST, ALT elevations. That was 7.7%. Diarrhea was actually a really infrequent reason to discontinue therapy, 1.5% with Tucatinib and 0.9% of placebo on the HP arm, telling us really that HP was driving a lot of the diarrhea. So in summary, HER2CLIMB-05 was a positive study. It showed that adding Tucatinib for both HR positive as well as HR negative first-line metastatic HER2 positive patients in the first line not only prolonged progression-free survival, but also prolonged time off cytotoxic chemotherapy for these patients.